Hi, everyone. We'll go ahead and get started. Welcome to the fifth and final Lunch with Links training. My name is Brooke Zerang, and I'm the COVID-19 training coordinator for the immunizations program. Joining me from the Links team today is Judy Green and Katie Lee. They will be presenting on generating reports in Links. This presentation will be recorded and later posted on the Links website, lalinks.org, under the Links Training Videos button. During the presentation, please type any questions you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. I will now turn it over to Judy, and I'll stop sharing my screen so she can share hers.
Good afternoon, everyone. Glad you could join us today. Today, we're going to go over just a few of the reports that a lot of people will use in their daily work in their in using links. So we just got a few reports that I'd like to go over with you and how they're run and how they can benefit your facility or your unit. I'm going to be using today the
Judy, we don't see your screen yet.
Oh, I'm sorry. You know I do that every time, don't I?
There you go.
Now you should see my screen. You see it now?
Yes, ma'am.
Okay, thank you. So today I'm going to be using the Rapides Parish Health Unit because I know they give quite a lot of COVID vaccines. So I'm just kind of pull them out to use to kind of demonstrate some of these reports. There's several reports that can be helpful in your daily work with links. So the first one we're going to go over is we're going to go over the lot number summary report. So we're going down to our menu and we're going to select reports. We're going to select the report module. We're going down to vaccinations and lot number summary report. This report will show us kind of a better detail of the different types of vaccines that we have on hand. And it's basically almost the same as what you have in your lot reconciliation report, but it's just a little bit more detailed. So I've picked here my organization, which is client server, which is our public health unit. This is the Rapides Parish Health Unit. And as you notice up here under the first little column, it says I can include order and transfer quantities. If I click on that, that means that when I run this report, it's going to show me any vaccines that are inventory that I might have transferred out of my inventory or any that came into my inventory, and just kind of give me a few more columns to look at. I'm going to subtotal this by my vaccines. Since we're only doing one facility, that's all I'll need to do. So once I've selected this, I've got my organization and my facility, and I'm going to deal with COVID vaccine. So I'm going to choose, and when I deal with COVID, I usually choose all of them just in case that I choose the Moderna, the Johnson & Johnson, and the Pfizer, in case they had all three of them in their inventory. So I'll add those to my vaccines that I want to look at, and I'll go down and I'll simply create the report. Once I do this, this is going to bring me up all the vaccines that this particular health unit has in their inventory, their COVID vaccines. It will list all the lot numbers. Here it will tell you their funding sources, their manufacturer, their expiration date. It'll show you the number of doses that they've received, how many doses they've actually given. This is how many doses that might have transferred in from somewhere else. These are the doses that they sent out to other areas. It'll show me any doses they wasted or returned to our office, any doses that they wasted because they expired or they disposed of or they weren't able to use them. And this is going to show us the ending doses. This ending doses is what they should have on hand in their refrigerator right now if they went to their refrigerator and checked. And then this last column will show their doses total, which will take all these doses and add and subtract, and will come up with this 200 doses. I go down here, this is, and it'll give me a total for all their, this is the Moderna vaccine. It'll give me a total of all the doses they've received, how many they've used, how many they've transferred in, out, if they've wasted any. And it'll show me right now in their fridge or freezer, they should have 756 doses of Moderna vaccine on hand. The next column, it will go down. It'll show me that they have Pfizer vaccine. It'll list all the lot numbers. It will show me how many doses they've received. It says they've not ever used any doses of Pfizer vaccine. That's kind of hard to believe. Well, I guess it's not because they transferred them all in from other places. So they've used this many doses. They've been given. They were all transferred into them. They've transferred some of them out, and it all comes in. And right now, this is what they should still have on hand today for Pfizer vaccines, which is under this column right here. Okay? And you can do this. If I wanted to run this report, because Rapids Health Unit has more than just the COVID vaccines, I can remove these out, and I'm going to run it for all their inventory. I can do the same thing. I can create a report, and I can see all the vaccines that this health unit has on hand at this time, which includes all their DTaP vaccines, their Hep B vaccines, their Hep A vaccines, any kind of inventory. So it's all right there, and it gives you the history of everything that's done with these reports here. Now, moving on, I have another report that I can run to do with inventory, and this report is called an Inventory Transaction Report. And this report will actually give us the different things, and you can run this report. You can run the other report by day or by month either also. But this report, you can actually go into your, let's say you're getting ready to place another order for vaccines, or you're checked your inventory and it's not correct, and you're maybe 100 doses off, and you're thinking, now what happened to that 100 doses, because it was an amount that I probably received in or sent out somewhere. So you can go to this inventory transaction report, and you can run this. I'm going to run it for COVID vaccines. And I'm going to run this report for the dates of March the 1st to March the 11th, which was yesterday. And I want to see any kind of transactions I've made with any of my COVID vaccines, just to get me a really close-up look. So I'm going to export this report because it will send it out to a spreadsheet for me. And when I open this spreadsheet up, this is going to tell me I'm the health unit. This says here that Wynn Parish Health Unit sent me over to Rapids Parish Health Unit on 3/1/21. They transferred me over 100 doses of the Moderna vaccine. Here's the lot number they sent me, and it'll tell me that it was received from another provider. Right here, we're going to go back in, and it'll say, I have a blank here, so it's going to say here that I received some vaccine, and I received this vaccine from, actually, I've received this from our BFC site in New Orleans, because that's our BFC approver. And this vaccine should have been received from, yes, it was received from McKesson, and here it will have the order number that it was received here, and it will show you the person that received the vaccine. It always has the people that received the vaccine or make these transfers, so that if you need to go back and ask a question for anything, you know who to go and ask the question of to see who made these transfers and these transactions in the report. And this is the only place that you're actually able to see the person that actually made any of these transfers or transactions. This report can be run for all your vaccines. It can be run on a daily basis. It can be run on a monthly basis, or you can run it for an extended period of time, whichever way you'd like to run it. Okay, the other report that we really kind of use sometimes for inventory, which I encourage everyone to use, is we have a report that is called Vaccine Lots to Expire. So we go right here for under the vaccinations, and you have a report that says vaccines lots to expire. When you pull this report up, you can put in your number of days to the expire. So I'm going to put a 30 in here, and I'm going to look at Rapides Parish Health Unit, and I'm going to see any vaccines that they might have that will expire in the next 30 days, because what we want to do is we want to be sure and move those vaccines. If we're not going to be able to administer them, we want to find a place to send them so they can be administered and they don't expire, because when you expire vaccines, that's money. So we're going to create this report, and you'll see right here that they have some pneumococcal vaccine. They have 3 doses on hand, and it's going to expire at the end of this month. And they're going to try to see if they have maybe some of these elderly people that come in that are even for COVID vaccine. Well, you can't give COVID and the pneumococcal same day, so excuse I said that. But let's say it was flu season and they were giving flu vaccine. They would try to encourage those patients to also get their pneumococcal vaccine, because they really want to try to use this vaccine before it expires. You can also run this report, and you can schedule this report so that each month you can schedule it that you will get a report each month telling you how many vaccines you have on hand that might expire. Now, if you wanted to put 60 days in here, you could create the report again, and it'll show you that they have some DTaP Hep B IPV vaccine that's going to expire within 60 days. They have some Hep A, Hep B. They have some TD adult. It's going to expire within 60 days, and it will tell you when it's going to expire, and it will tell you the doses available that they have, which they most probably will be able to easily use in that length of time. So those are mainly your 3 inventory vaccines. Of course, we went over the other day, we went over the lot numbers reconciliation, which you can look at any time, and it will show you how much vaccine that you should have on hand at any particular time, and it will list them all out for you by vaccine, and it will show you how much quantity you should have on hand at that time, which will always show you all your vaccines. It won't just show you your any particular kind of vaccine. So that's always your reconciliation. Okay, and let's stop for questions on inventory if we could, and see if there are any questions here. Okay, nice. Okay, the next report I'm just going to kind of breeze through is your patient detail, because we went over it yesterday in detail on how you can run a patient detail report. We'll go back to the report module. And I'm running this patient detail report for the Rapides Parish Health Unit, and I just want to get a listing of everybody in the health unit that received COVID vaccine, and I'm going to use the date of 3/11. And I'm going to go down and I'm going to find the COVID vaccines and push them over, because that's what I'm looking for. And once I do that, I just want to see everybody that received vaccines. I want all my patients that are active and inactive, and I want it to be done by services. I showed you yesterday, we want to run all of our reports by service. We also always want to include active and inactive patients and the vaccine that we're looking for. And then we want all of them that decremented or all of them that didn't decrement, but today we just want to see all of our patients. So we simply go down here and we're going to export the report. Once we export the report, we're going to get this report up, and it's going to come up with all of our patient ID numbers, name, middle name, last name, birth date, guardian name, phone number, the facility where they received, that owns the patient, the vaccine they were administered, the manufacturer code for the vaccine, the lot number, and it will tell us here if the vaccine decremented the inventory or if it didn't decrement the inventory. Right over here, if you have your vaccinators in there, it will tell you who actually gave the vaccine, that they were given the BIS information sheet, and it will show you if any of those vaccines were deleted off the record after they were administered, which sometimes happens. We'll show you the vaccination facility, so it gives you all the details on those vaccines that were given. Another report that we use is the daily patient immunization list. And this report, you can't go in and just run it by a vaccine. You can only run it for everything that was done that day. And that would come under your daily patient immunization report here. And what this report will do, and a lot of times it helps in seeing vaccines that were given and they maybe didn't decrement. If that person's not on this daily patient list, that means that patient didn't get into links for some reason or another, or the vaccine did not decrement. So sometimes that's a quick way also of, so we're going to look at everything that was given on 3/11/21 at the Rapides Parish Health Unit. We're going to go down here, and there's a little thing that says utilize the checkbox. It'll just make it run faster. So I always just say high dose number because we really don't care what dose number. We just want to see what was given at the health unit on the 11th, or what type of vaccines. And what this report will do, it will bring you up all the patients that were given the vaccine. It will have their last name, their first name, the type vaccine they received, and you see here's one got a Tdap, a varicella, a HPV9, a meningococcal, a Tdap, and then COVID vaccines. I did not select don't run the dose, so it told me what dose number it was. It'll give me the health unit where they got it, and it'll also tell me who administered that vaccine. So that's just a little report that will show you, you can run each day to show you how many patients received the vaccines, and generally at the bottom, and I think I blacked it out and didn't mean to, it will give you a total. It'll give you a total number of patients and a total number of vaccines that were administered. Okay, another report that you can run, let's just say, and I'm going to run this a couple of ways, let's say that the medical director at the Rapides Health Unit wants to know how many vaccines were given at his health unit for a certain week or for a certain day or for a certain few days. So we have a report that's called, and he doesn't care anything about it. He just wants to know how many were given. So we're going to go to report module, and there's a report here that we can run that's called Vaccination Totals. And we're going to run it for Rapides Health Unit again. And what we're going to do is we're going to run this report for we're going to say he wants to know from the first of the month through yesterday how many vaccines have been given at the Rapides Health Unit. Okay. And he's going to ask for you to give him for example, he might want you to tell him how many vaccines is each vaccinator in the health unit given. Or he might want to tell you what zip code, how many by each zip code, or you can put how many by each parish in case somebody came outside of Rapides Parish. He can also just give you the total vaccinations by vaccine. So that's what we're going to do right now. We're going to see how many vaccines were given in the health unit from the 1st to the 11th. So we're going to create this report. And this is going to tell us that at the Rapides Health Unit, since the 1st of March, they have administered 505 doses of the Moderna vaccine. They've administered 1,078 doses of the Pfizer vaccine. They've given a dose of DTaP-IPV. They've given 2 doses of HPV vaccine. They've given a dose of varicella vaccine. And what it'll do over here is the percentage, total vaccinations they gave since the 1st is 1,595, and this percentage is the percentage of that 1,595 of each one of these vaccines that were given. So that's a report that a lot of times, and this report a lot of times will be run because I can take out this Rapides Parish Health Unit, for example, and not limit the health units, because a lot of times some of our upper management at the central office will want to know how many vaccines were given in the parish health units in February. And we can put February dates there. We can put, if I could type right. And they want to know how many doses were given by each health unit. So we're going to say he wants to know how many were given at each facility. So we've got the whole month of February here. We're going to go down and create that report. And it's going to show us for the month of February that our public health units gave 17,775 doses of vaccine. And it will give you each parish health unit and how many doses that they have actually administered. And that's all the vaccines. That's not just the types of vaccine. This is all the vaccines they've administered in those health units. So this is especially when you have big organizations like LSU or Our Lady of the Lake or Ochsner, and they want to see how many vaccines were administered in their particular facilities during that month. This can also be broken down by vaccinator. It can be broken down by vaccines. So it's just a report that gives you figures, but it doesn't really give you a lot of information except some numbers. So that's basically, unless someone else can think of a report or have a question as to what they would like to be able to see when they run a report, those are basically the fundamental reports that we use in Links on a daily basis. Okay? And that's all I have, unless there's some questions.
So if anyone has any questions, feel free to unmute yourself or type it into the chat box. I don't see any questions as of right now, so we could give everyone just a couple minutes.
Okay. Did you have anything to add, Katie?
Nope, nothing to add.
Okay, as I'll tell you each day also, let me go back up. On your home page of Links, our state is divided into regions. Our regional map is listed here on the home page. It's color-coded, and over to the right, it'll give you right here, it'll show you what parishes or what region, and over to the right, you will have your regional contact for each region. It has their name, their phone number, and their email address, and they're always there to assist you. We also have on the home page, remember, we have the chat box where you can chat the help desk. We have a help desk, also phone number and an email for the help desk. So you can chat with the help desk, you can call the help desk, or you can email them if you have a question. And that's all I have.
So we have a question on the chat box, which is pretty good since you're on the right page. Where are the help videos on the home page?
Okay. On the home page, under your Links training videos, are where all of your training videos are listed. And may I tell you that we are in the process of updating a lot of these. We're hoping, Katie, I would say in the next month or so, we're going to have a lot of new ones. We're going to have a lot of updated ones. And I think you'll be real happy with the way they are. But right now we have all these videos, and they go from MyIR to how to add vaccines, how to put new patients in, how to create certificates, how to set personal settings. And most all of these vaccines, except for just a very few, are like about 3 minutes long. We got a couple that are a little bit longer than that. But and it also has how to create your lot number summary, how to create a lot usage report, how to create a provider submission report, how to create vaccination totals. So it's just basically as many reports as we could think of to get them ready. But now we're going to have some more that are going to be, and we also have the provider agreement, the redistribution agreement. This is for the COVID vaccine. We have the transfers. And then we also have the previous three. I don't see the fourth one, but we have the previous three Lunch with Links that we recorded, the one vaccine administration, patient demographics, the vaccine orders and transfers that are also available for you there.
Yes, and yesterday's training should be up by the end of the day today.
Okay.
And then we'll have this one uploaded by next week as well. And so Paula says that she's having some trouble finding the YouTube videos on the homepage. So Paula, you might just have to scroll down a little bit in order to find it. Does anyone else have any questions? All right, Brooke, I'm gonna pass it back to you.
Thanks, Katie. Thank you everyone for attending today's training. For more information, like Judy shown earlier, you can visit lalinks.org, or for any links related questions, please email la.links@la.gov. Thank you.
Y'all have a great day.